Do your ankles become so swollen that it's difficult to flex your feet? I'm not referring to the minor bloating you might experience following an extended flight. I'm talking about legs that resemble dense logs with skin pulled taut, and those lasting, profound marks your socks imprint, a condition known as pitting edema. Does this describe your nightly reality? Pay close attention, because that significant fluid accumulation isn't merely a bothersome inconvenience. It is a glaring, urgent signal that your circulatory network is under severe strain. When liquid collects persistently in your lower legs, gravity is triumphing in the battle, reducing your blood flow to a sluggish trickle. This impaired circulation is referred to as venous stasis, and it creates the ideal conditions for hazardous, potentially fatal blood clots known as deep vein thrombosis, or DVT. This is, at its core, a serious circulatory health problem, not simply a superficial concern. You have probably attempted every conventional recommendation, propping your legs up, soaking your feet, or drastically reducing your sodium intake, and yet the swelling remains. Why is that? Because you are only addressing the visible symptom. You are overlooking the essential nighttime regimen that doesn't just handle the fluid, but proactively and vigorously reverses the entire process as you rest. I am providing you with the conclusive 7-step bedtime vascular restoration plan. We will methodically cleanse, fortify, and manually expel the fluid from your legs before you even settle onto your pillow. Upon waking, your feet will be slender, supple, and feeling so normal they will glide effortlessly into your most comfortable shoes. This protocol tackles the underlying source, chronic venous insufficiency. And please give this your full focus. Step number 7 contains the pivotal clinical secret, a potent natural botanical that specialists utilize to reinforce vein walls from within. Do not overlook it. We begin now with the internal foundation. The common guidance to merely consume less sodium is frequently insufficient. Edema is often the result of a severe imbalance among your key electrolytes sodium, potassium, and magnesium. Your kidneys, which oversee the majority of your body's fluid regulation, demand a precise equilibrium of these minerals. When you lack adequate potassium or magnesium, your cells tenaciously retain sodium and, as a consequence, water, leading to that pressurized accumulation we observe as swelling. Therefore, we are initiating a cellular pre-sleep cleanse. 60 minutes prior to your intended bedtime, you must execute the first step, which involves magnesium and potassium. Magnesium citrate acts as a natural relaxant for smooth muscle. It assists in easing tension within your blood vessel walls, the very veins we aim to clear, and supports proper cellular hydration. I suggest 1 full teaspoon, approximately 300 to 400 mg of elemental magnesium blended into 12 ounces of water. The secret component here is potassium bitartrate, widely known as cream of tartar. Potassium serves as the principal regulator of fluid inside your cells, working in direct opposition to sodium, which operates outside the cell. By elevating potassium levels, you instruct your cells to release excess sodium and water. Add a generous pinch, about 1/4 teaspoon, of cream of tartar to your magnesium beverage. Drink this mixture slowly, 1 hour before you plan to sleep. This timing is vital because it provides your kidneys and vascular system a preparatory period, initiating a gentle system-wide fluid release before you recline and gravity ceases to aid the process. Recall, our objective is to get the fluid moving while your posture still permits gravity to assist. If you have any pre-existing kidney condition, you must consult your doctor before making substantial changes to your potassium or magnesium intake. For all others, this is the essential first step. Your body is now internally prepared, but that alone is insufficient to counteract the strain of persistent swelling. We must physically jolt those veins into compliance. When blood is permitted to pool in your ankles, the veins become sluggish, enlarged, and lose the essential tension required to propel blood upward against gravity's pull. We will activate a natural, powerful vascular pump through thermal shock, known as the hunting response, which induces a rapid cycle of contraction and release. This employs the contrast bath method, tailored for pre-sleep application. You will require 2 basins. Fill one with water as warm as you can comfortably endure, and the second with the coldest tap water available, adding 5 or 6 trays of ice cubes to guarantee it is intensely cold. The procedure is straightforward. First, submerge both feet entirely in the hot water for 3 minutes. This induces significant vasodilation. Your veins expand widely, drawing stagnant blood and fluid closer to the surface. Second, promptly switch your feet to the ice water bath for a full 60 seconds. This is the challenging part, so remember to breathe deeply. The extreme cold triggers powerful vasoconstriction. The veins instantly constrict, forcibly ejecting the blood and trapped fluid from the area into your central circulatory system. Repeat this complete cycle 3 times, 3 minutes hot, 1 minute cold, 3 minutes hot, 1 minute cold, and conclude with a final minute in the cold water. The immediate advantage of this last cold plunge is substantial. When you remove your feet, the skin immediately begins to warm, causing a massive reflexive opening of the veins, a flush. This generates a powerful suction effect, pulling fresh, oxygen-rich blood into the lower legs and carrying away all the accumulated waste and fluid. This is the single quickest method to manually decompress your lower legs before you climb into bed. We have now cleansed the system and stimulated the veins. Yet gravity remains a constant adversary. If you merely rest your legs passively on a cushion, the process is slow and ineffective. To genuinely mobilize trapped fluid, you require a dynamic component. You must engage your powerful calf muscles, often termed your second heart, to compress the veins that run through them. This is the core principle of the muscle pump. The technique is adapted from the restorative yoga pose Viparita Karani, or legs up the wall. Lie flat on your back near a wall and slide your hips as close to the wall as possible. Swing your legs straight upward so your heels rest against the wall, forming a perfect L shape with your body. This position elevates your lower legs above your heart, allowing gravity to aid the process. Here is the critical adjustment. You cannot simply rest there passively. Every 60 seconds, you must perform an active ankle flex. Point your toes powerfully toward the ceiling for a count of 5. This is the stretch. Then, strongly flex your feet, pulling your toes back toward your head for a count of 5. This forceful muscle contraction is what actively squeezes the venous reservoir within your calves. Repeat this point and flex sequence 10 times per minute for a total duration of 5 minutes. This is active gravitational drainage. The active pumping, combined with the inverted posture, creates the maximum pressure gradient, pushing fluid from your ankle reservoirs upward into the larger veins of your thigh and pelvis, where your primary circulatory system can manage it effectively. 5 minutes of this practice is equivalent to receiving a deep, active lymphatic drainage massage for your entire lower body. Make this 5-minute session non-negotiable every single night. We have drained the fluid. Now we must reinforce the plumbing itself. Why does fluid seep out of your blood vessels initially? Because the walls of your smallest vessels, the capillaries, become fragile, porous, and leaky due to inflammation and free radical damage. We require a topical application that can tighten and tone these compromised vessels. We are moving beyond a simple moisturizer and utilizing concentrated botanical venotonics blended with a carrier oil. Cypress essential oil is highly esteemed for its venotonic qualities, helping to decrease blood vessel permeability and strengthen capillary walls. This constitutes the structural repair of the massage. You will need 5 drops. Rosemary essential oil is a potent circulation stimulant. It invigorates local blood flow, ensuring the fluid we just mobilized is rapidly transported away, preventing it from immediately settling back. You need 5 drops of rosemary oil. Mix the total of 10 drops with 1 tablespoon of a carrier oil, such as fractionated coconut oil or almond oil. This is not a quick, superficial application. It is a targeted, therapeutic massage. Sit comfortably with your legs extended. Starting with a small amount of the oil blend at your toes, employ firm, upward strokes to massage the oil deeply into your feet, working toward your ankles and then up your calves. It is crucial to always massage in the direction of your heart. You are manually supporting venous return. Dedicate extra time to the lower half of your calves and conclude the massage just below the back of your knee. This rub stimulates local nerves, drives the active components deep into the tissue, and delivers the anti-inflammatory action necessary to mend leaky vessels. The veins are now toned, and the fluid is drained. Next, we must safeguard that achievement throughout the entire night. Step 5 involves compression, but if you're using the incorrect type, you could be constricting your circulation. If you have been prescribed 20-30 mmHg compression stockings for daytime wear, that is suitable. However, you should never sleep in high-grade compression garments. When you lie down, your blood pressure equalizes, and those strong stockings can perilously restrict your blood flow, creating a tourniquet effect overnight. We require a therapeutic maintenance level. The secret is low-grade therapeutic compression, typically found in light travel or flight socks. Seek out socks rated between 8-15 mmHg. This is the perfect pressure level to maintain the edema reduction we've accomplished with the previous steps without impeding flow while you are horizontal. These socks provide a constant, gentle squeeze, preventing the tissue spaces from expanding and reabsorbing fluid that your kidneys are still processing during the night. The manner in which you wear them is crucial for general edema. Ankle or calf height is adequate. Most importantly, inspect the top band. If the elastic creates a visible, deep indentation in your skin, it is excessively tight for nighttime use and is acting as a dangerous ligature. Roll the band down or switch to a looser, fitting pair. The compression must be graduated, not concentrated at the top. Put them on immediately after your oil massage, securing the fluid reduction you've achieved. We are 5 steps complete, and you are nearly ready for bed. However, before you get comfortable, you need to recognize that one of your most common evening habits, the way you hydrate, is undermining all your efforts. When you drink water, it does not exit your body instantly. It is filtered by your kidneys, and this process requires time. Your body is also less efficient at processing large volumes of fluid when you are lying flat. Gulping water right before bed ensures that fluid will simply settle via gravity into your lowest extremities. You must institute a strict 3-hour fluid fast before your designated lights out time. If you plan to be asleep by 10:00 p.m., your last substantial sip of water should occur no later than 7:00 p.m. This means ceasing the large glass of water, the herbal tea, or any other beverage. The sole exception is a small sip to swallow your supplements for step 7. By implementing this cutoff, you grant your kidneys a full 3 hours to perform their final fluid regulation cycle while you are still predominantly upright. This ensures the maximum amount of excess fluid is processed and eliminated before you assume a horizontal position where gravity hinders venous return. We are now prepared for the internal, systemic repair. Everything we have done thus far has focused on drainage and physical tone. But the root cause of chronic edema is frequently chronic venous insufficiency, meaning your capillary walls are leaking. We need a pharmaceutical-grade natural supplement capable of repairing this damage. This two-part combination is the most scientifically supported natural therapy for CVI and edema. First, horse chestnut seed extract. This is the clinical powerhouse. HCSE contains a compound called essin, which has been demonstrated to significantly seal capillary walls, reducing their permeability, the leakiness. It also promotes the release of prostaglandins, which improve venous tone. You need a high-quality product standardized to contain 50 mg of essin. Take 300 mg of HCSE with your last small sip of water. Second, pycnogenol. This is the support agent. Pycnogenol is an exceptionally potent antioxidant that strengthens the collagen matrix surrounding your blood vessels. It enhances microcirculation and exerts powerful anti-inflammatory effects, working synergistically with HCSE to repair and reinforce the entire vascular structure. Take 100 mg of pycnogenol. Why take this at night? As your body enters its deep sleep cycles, it shifts into repair and regeneration mode. By consuming this powerful venotonic combination right before bed, You are flooding your system with the raw materials required for vascular repair at the precise time the body is most receptive to healing. This combination is how you progress from nightly management to the long-term resolution of your edema. That is the definitive 7-step protocol. You are now equipped, but before you settle in, I must address the one major habit that instantly negates all this circulatory work. You are likely doing it at this very moment, crossing your legs. Whether you are seated on the sofa or lying on your side and wrapping one leg over the other, crossing your legs creates a physical clamp, a kink in the hose, on the major femoral artery and vein, which are responsible for returning all that blood and fluid upward. It immediately forces stagnation in the lower leg. Tonight, when you settle in, make a conscious effort to keep your feet flat and your legs parallel. If you are a side sleeper, place a thick body pillow between your knees. This maintains alignment of your knees, ankles, and hips, ensuring the femoral vessels remain open and unobstructed. This is the final, crucial step, maintaining the open pathway. You have cleansed the pipes. Now, keep the water flowing. You now possess the complete vascular revival protocol. The magnesium-potassium flush, the 60-second ice shock, the 5-minute wall climb pump, the cypress rosemary vine rub, the 8-15 Mem-Hg compression correction, the 3-hour fluid fast, and the HCS pycnogenal vascular repair. This is not magic. This is applied vascular science. Edema is fixable, and you now have the actionable nightly plan. Implement these 7 steps tonight. Do not wait. Your comfort and your long-term circulatory health depend on it. Now, if you wish to learn about the 3 common everyday foods that are silently destroying your vascular elasticity and fueling this chronic inflammation, locate my next video. That is the critical next step toward achieving a permanent solution.